am Dr. Debabrata Biswal. I am a practicing neurosurgeon in Apollo Hospital, Bhubaneswar. I have been practicing here since 13 years and I have been doing brain tumors and high-grade tumors since the last 15 years. So today we will speak about brain tumors in particular, and brain tumors which are high-grade tumors. And high-grade tumors are basically those brain tumors which grow very rapidly and they bring out symptoms very fast, and the patients usually present with headache, vomiting and a few neurological symptoms. And the mainstay of treatment of high-grade tumors are basically surgery, and this surgery is mostly directed at debulking the tumor to maximum resectable tumor tissue without endangering the normal tissues and trying to preserve the brain's normal functional part. So basic is resection of the tumor maximally, followed by radiation, external beam radiotherapy, and this radiotherapy mostly consists of a around 60 gray radiotherapy, which is given in various fractions, and it usually ranges from 4 to 6 weeks of radiation. And then concomitantly we can also give chemotherapy. Chemotherapy can be of multiple, either systemic variety, and also can be of localized chemotherapy. Now, systemic chemotherapy is mostly with temozolomide and bevacizumab, and for that we can give them orally temozolomide for over a period of 6 weeks to 8 weeks. And localized chemotherapy is using carmustine wafers at the site of the brain tumor. After resection of the brain tumor, the residual part gets exposed to the carmustine wafer. Now, the advantage of this is, as carmustine wafers are directly given at the site, so the systemic toxicity is less. Direct drug delivery to the effective tissues is more, and third is that we get less of side effects in that area, and the penetration to the tissue levels is higher. Surgical infections, there may be some hemorrhage, leftovers, or some neurological deficits. In radiation, mostly the side effects are the patient has lassitude, tiredness, there will be skin parchments, there will be loss of appetite and fatigability. And in chemotherapy also the same thing happens. There is lack of appetite, lassitude, with myalgia, and there may be a little hair loss. So these are the main side effects of chemotherapy. And but overall the brain tumors are well treated with surgery, radiotherapy, and with it the localized chemotherapy with carmustine wafers. The care given post-treatment is we can go for physiotherapy, which actually involves in doing physical activities which increases the power and tone of the muscles, or we can go for occupational therapy, in which finally the patient has to get back to life and utilizes his muscle strength to go back to his strength. And the last is rehabilitation, where the patient is again treated back and is sent back to normal activity of his lives.